First one and foremost, have you reviewed your health insurance options this year? Some just renew, some just trust their advisors, some work with the health insurance companies directly. Advisors in the under 50 marketplace are paid for by the insurance company. There are no add-on fees that need to be charged by advisors when you're a company of under 50. So for 80% of the chamber members, advice is take advantage of working with an advisor. There are many that belong to the Chamber of Commerce here in Worcester. We're two advisors ourselves with firms here in Worcester. So definitely review your options. It's open enrollment time, and now's the time. Is your employer contribution in compliance? You need to contribute in the under 50 at least 50% of the single rate and 33% of the family rate. Believe it or not, there are employers who say, I'm only paying 10 or 15 or 20%. Or the rate increase went up and they passed it on to the employee, and thus by default the percentages. You got to check this off the box to make sure that you're contributing the correct percent. Are all your eligible employees being offered health insurance? We had a client a new client who had a Department of Labor inquiry because the part-time person didn't have health insurance, and when she was fired, she complained to the Department of Labor about some wage issues, and thus spun into the conversation, I don't think I was offered health insurance. So the Department of Labor in writing wrote to the employer, said please contact us, and there was a discussion, and they asked the employer very simply, can you just give me something that shows what the eligibility is? So this client, wasn't a client at the time, said, oh, they just photocopied the health insurance company's master application that said 90-day waiting period. Department of Labor says, no, that's really not what I'm looking for. I'm looking for a document that explains eligibility of your health insurance. It's called a summary plan description or an ERISA wrap doc or what have you. As you're working with your advisor, bring that to their attention and see if these types of programs are something they can help you with. So the client hired us, we put together the ERISA summary plan description, sent it to the client emailed it over to the Department of Labor, and they said, this is one of the best documents we've seen. Thank you. Claim denied. Okay? So that's an example of where is eligibility even written down for a small employer. Does your health plan meet all the credible coverage tests? I think at this point, 2, 3, 4 years into healthcare reform, probably if you're working with one of the major partners that are here today, they wouldn't offer a plan that isn't meeting credible coverage. So if you have a health plan not with one of the providers in the room today, then maybe that question might be applicable. Is your Section 125 plan in compliance? So a lot of employers still pay 100%, but then they say, geez, I went to that seminar, Dave, and Todd, you made sense about asking the employee for a contribution because they're going to pay it, they're not going to quit on me, and we're all going to share on the cost. So the employer calls the payroll company, or they have their payroll done self-administered in a small company, and they start taking it out pre-federal, state, and FICA. Some take it out after, but you can take out the contribution pre-federal, state, and FICA. But in order to do that, you have to have a Section 125 plan in place. Very quickly, it's just like a retirement plan, a 401k prototype document, same concept. So if you take employee contributions out of an employee's paycheck without a Section 125 plan, and you get audited, the penalty is that you'll have to put all those contributions back in and pay retroactive FICA and probably match what your employee didn't pay for FICA. So let's not do that. Ask your advisor to help you with your Section 125 plan. And someone told me early in my career is, what's a legal section? If you're asked to show you Section 125 and you can't find it, then you don't have one. You can't say I had one and lost it. If you can't touch it, you don't have it. And then you need to keep it updated. So I put there, where is that Section 125 document is really the question you have to ask. And then the last one is your summary plan description. And lastly, firms like Todd and I, we take it to the next level. We also assist with employee handbooks. I would say 60-70% of small businesses under 10 don't have an employee handbook. So that's for another seminar speaking series with some legal counsel here. But not only do you address eligibility and some basic rules, but employee handbook has everything in it. Cell phone policy, non-compete, sexual harassment policy, smoking policy, computer usage, blah, blah, blah. If you don't have one of those, firms like Todd and I can assist you in putting that together. So, Todd?
We've covered a lot. I want to thank you on behalf of David and myself for coming. I hope we've given you some insight as to where we were, where we are, in part where we're going, and that's still be determined. There are a lot of things you can do as an employer to effectuate your group plan, your health plan, your platform. Hopefully we've given you a few tips and hints and strategies, some disturbing questions that David went over, which again, for most of you probably aren't necessarily disturbing, but just more reminders. It's a complex world. I call it a world of spaghetti. And if we can help decode that and straighten it out for you, or others can, rely on advice and guidance. It's only going to get more complex. We have a new administration. There's going to be new taxation rules, laws, all of that. It's still an incredibly important benefit to all of your employees. It's an attraction and retention. So to the greatest extent we can, or someone like us can facilitate putting a best-in-class program together, take advantage of that. I want to put in a big plug to the Chamber for hosting this, clearly well attended. If there is more in terms of subject matter down the road or other components that are important to you related to this type of subject matter, we'd be delighted to engage. And then to our